University of Port Harcourt, Africa Center of Excellence, Center for Public Health and Toxicological Research, PUTOR. Report on PUTOR Sensitization Fora on Lassa fever and novel coronavirus. February 2020. Lassa fever has been a recurrent health challenge in many parts of Nigeria. The epidemic is synonymous with the dry season in Nigeria between December and April, the annual peak periods, when farmers and residents set bushes and rubbish bins on fire. The virus came to public notice in 1969 following the death of a missionary nurse in the town of Lassa in present-day Borno State of Nigeria. The multi-mammate rats are responsible for spreading the deadly virus, especially in slum neighborhoods with poor sanitary practices. In response to the latest seasonal outbreak of the virus that results in a hemorrhagic fever, which claims an average of 5,000 lives in the region each year, the African Center for Public Health and Toxicological Research, PUTOR, mounted a well-attended one-day awareness campaign for inhabitants of Port Harcourt, where the university is located. Subject matter specialists, stakeholders and first responders took turns to sensitize the populace on the symptoms of the deadly virus and possible prevention measures against the virus. Following the recent outbreak of the novel coronavirus, the university management directed PUTOR to organize another sensitization campaign to create awareness and preventive measures against the virus amongst the general public. PUTOR, in turn, incorporated the Faculty of Science and the University of Port Harcourt School of Public Health to organize a one-day sensitization forum for the public and the entire university community on the virus. Speakers were drawn from within and outside the university to share information on available information on the virus at the time. The experts also explained the patterns of infection and remedial measures aimed at preventing people from contracting it. Various modes of communication were employed to create awareness on the emergent novel coronavirus. Practical demonstrations on the mechanisms of prevention of the coronavirus infection was carried and participants were given opportunities to ask questions. Methodology. In a bid to reach out to a large segment of society, the PUTOR Management Committee produced banners, flyers, T-shirts, face caps, including electronic media appearances to reach the relevant publics. The university's website and other social media sites were utilized to invite staff and students and guests from within and outside the university to participate in each of the sessions. The Rivers State Ministry of Health, the primary healthcare providers, and other first responders were also on hand to play critical roles in the sensitization efforts. The one-day sensitization forum on Lassa fever and novel coronavirus was held on Tuesday, 11th February 2020 at the Bitimi Banigo Auditorium, located at the University Park. The Vice-Chancellor, Professor Ndowa E. S. Lale, who was chief host, declared the event open and commended PUTOR for packaging the well-patronized event that dispelled most of the myths woven around the novel coronavirus at the time. The workshop featured some speakers from different backgrounds and a panel session at which issues raised by the resource persons were further ventilated through a robust interactive process in each case. The resource persons that handled various topics at the sensitization forum on the novel coronavirus included Dr. Omosivie Maduka, consultant epidemiologist at the University of Port Harcourt Teaching Hospital; Dr. Godin Owonda, Director of Public Health and Disease Control, Rivers State Ministry of Health; Dr. Datonye Alasia, consultant infectious diseases and respiratory physician at the University of Port Harcourt Teaching Hospital; and Dr. Chinwe Ezirim, Acting Director of Health Service, University of Port Harcourt. Members of the organizing committee: Dr. Kingsley Patrick Iwanyang, Chairman. PUTOR wishes to express gratitude to the university management, collaborating partners, other stakeholders that organize these sensitization campaigns amongst the inhabitants of Rivers State. We also wish to thank the AAU and the World Bank for their encouragement in the discharge of our statutory mandates in the advancement of public health and wellness in the West African sub-region and beyond.